Hi, this is Dr. Valentine, and you probably have already seen one of our testimonials on many of the different types of chronic health issues that we address in our office. But this particular talk that I'm giving right now, this information, is targeted for those individuals that have a thyroid problem, whether it be hypo, whether you've had Graves' disease, whether you've had thyroid cancer, God forbid, or if you suspect that you might have a thyroid problem, but it has gone undiagnosed. Well, the thing about the thyroid is that many times it's going to take anywhere between 10 to 15 years before you get the official diagnosis that you have a thyroid problem. Let's give you an idea of the symptoms, though, that would occur that could put you in this category. One, do you got brain fog? Do you have some memory issues, memory lapses? You go into a room and you forget why you went into the room. Or your recall is delayed. You know, you just can't think of things right away. And you know, you might say, well, it's part of the getting older process. Well, it really, truly is not. It's all part of that thyroid. Now, it could be a constipation problem. That's a classic type of problem that comes with the thyroid type of issues. Maybe even had such a gallbladder. Gallbladder is a common problem with the thyroid as well. Maybe you've had your gallbladder removed and you still have problems. We see that all the time. Maybe you started with female problems at a relatively young age. Maybe you had a menstrual cycle that was very painful. You had to take ibuprofen, Tylenol, some other drugs, and you end up having some condition called endometriosis. Maybe you had a problem where your menstrual cycle was irregular. If you're older, maybe you now have gone into a state where you're already in menopause in maybe your mid-40s. Or you're in a perimenopausal state exhibiting those symptoms and you're still in your 40s. Understand that your menstrual cycle should occur until about the age of approximately 52. Other conditions would be situations like irritable bowel. That's really common, where people have a gut situation going on along with the thyroid. So there's a other classic symptoms that I just thought about is like thinning of the hair, the loss of the outer 1/3 of your eyebrows, maybe skin conditions. So you can see, you know, with the thyroid comes a lot of different issues. Maybe you've had some nodules on your thyroid, maybe you've had a goiter, and yet your TSH is not in the range that which is considered, you know, classic hyper or hypothyroid type of issue. What we do is we go ahead and investigate the thyroid much more comprehensively. One, we're going to rule out, do you have an autoimmune thyroid problem? That's going to be with the thyroid antibody test, TPO, TGB, as well as the hyperthyroid antibodies. We're going to run thyroid stimulating hormone. We're going to run total T4, total T3, free T4, free T3, reverse T3, T3 uptake, and even possibly thyroid binding globulin, which is necessary. So you can see there's a lot of complexities towards this. We're just giving you a little bit of insight into the thyroid problems. You can always get more information. You can call, make an appointment, and talk with us. Our number is 714-964-9566. Thank you.